Hey guys, welcome back. This is Dental Unfiltered. I'm here with my normal co-host, Dr. Andrew Vallo, and today we have a good subject for you. It's new perio patients. Perio patients are obviously more demanding than hygiene patients, and when they come, sometimes it seems like we have problems telling them that they need 4 quads of perio and it's X amount expensive. And I've noticed like hygienists and case presenters that when perio's on there, it becomes this giant speed bump that they just stop like a deer in headlights in. And I have practices that like just roll with it. And, there's a lot of things with it. Like you probably shouldn't call it scaling and root planning because that invokes fear. And that's the deal. Perio patients are high dental anxiety. They've avoided you for a long time. That's why they're perio. So, Dr. Vallo, you picked the subject. How do you guys uniquely handle new perio patients?
Man, that was great, Matt. It's like you read my mind. I just so you know, Matt and I, we don't like prep these podcast episodes. We don't do a dry run. We don't sit back and discuss the, questions and discussion points. Literally what happens, it's usually the morning of, usually I'm at the gym or whatever before we start recording. I'll normally send Matt like a bullet point of like 3 to 4 subjects I want to talk about. And they're like really small bullet points.
There's no detail. They're titles.
They're titles. So this text, this episode, I just said new perio patients. And in my mind, as he started the episode, I was kind of thinking like, I hope he has like some idea of which direction I want to go here with.
Oh, I know the problem with perio patients.
Like there's a lot of different ways that we could have went or talking about how to attract more perio patients or, diagnosing perio, whatever it is. But you hit the nail on the head, and that was exactly what I wanted this episode to be about, which is how do you, as a doctor, as an office manager, as a hygienist, as a treatment coordinator, how do you deal with the patients that are new to your office that need periodontal treatment that one, maybe don't know or don't think they do, or have been going to another dentist for years and they just moved the area and their other dentist never said anything about this and they think you're trying to pull a fast one on them, or for us, honestly, our biggest pain point is we advertise our non-insurance special. It's $98 and it includes exam, x-rays, standard cleaning, and they get a free teeth whitening gift. So we do get a fair amount of new patients that come in without insurance specifically for this $98 deal. And then they get in there, and unfortunately, if you just go by statistics, patients without insurance visit the dentist less often. It's more likely it's been a longer period of time since they came in since they had their last dental cleaning, and it's more likely that they're going to have active periodontal disease. So, of these patients coming in for this $98 special, there are a decent percentage of them that don't need a healthy mouth prophy and don't qualify for the $98 special. And so it does create some hurdles for my team as far as the discussion around the treatment needs. And so I want to talk about exactly how we deal with it, how we have a potential compromise for patients that can prevent major issues from happening, bad reviews and things like that. Um, so, we'll kind of dive in a little bit, I guess. First of all, as these patients are, being as the initial exam is happening and the perio charting, our team knows to talk to the patient throughout. So, they're kind of educating them as they're going, letting them know what healthy, tissue looks like, what healthy numbers look like. We've now got AI software, so we're able to show the patient on the software where areas of bone loss. It blows, it really lights up areas of subgingival calculus and things like that. So it's nice that we've got another diagnostic tool, that it's not just our hygienist, our doctor that's saying these things. It's also this tool that's kind of lighting it up and showing the patients as well. So we're doing as much education about what's going on during that initial exam process. We're also discussing what periodontal disease is. What is gum disease? So, gum disease is essentially an infection in your gums. I mean, that's what it is. Bacteria causes an infection in your gums. So we let the patients know that it's not like, hey, you've got a little bit of bone loss, or hey, your pockets are kind like, what does that mean? I've got deep pockets. So we're not talking about things like that. We're not talking about, oh, you're going to need a deep cleaning. My team knows to separate periodontal therapy, gum disinfection therapy, whatever you want to call it. It's a therapy, it's a treatment. It's not a regular cleaning, deep cleaning, light cleaning, deep cleaning. It's not like that. So we are separating the idea of periodontal treatment, SRP. It is a treatment. It's totally separate from a cleaning.
I think the association, like, we talk about it. I think the problem is hygienists come in or case presenters, and they say, "We have to do a special kind of cleaning." Then we have patients that say, "Well, I just want a regular cleaning."
Yep.
And the fact you're calling it a cleaning is wrong. Like,
Yes, I agree. I
it
agree.
has to be a treatment. So here at Energize, we do case presentation training, and I say whether I'm in a crowd or in person or on a webinar, I say, like, I want to profile a patient and they have periodontal disease. When you go in and explain it to them, how would you call it? People say a cleaning, a deep cleaning, and a deeper cleaning. They have all these different words they use. And the moment you label a cleaning, they just go, I don't want to spend this much money for a special cleaning. I want a regular cleaning. We say you should call it 4 quads of gum therapy, because 1, it's not fear invoking, these people are high dental anxiety, and 2, you're not really calling it a cleaning. I think it's a very big critical mistake to label it as a cleaning.
No, I agree 100%. I think you've got to separate it. So, there's not the option of doing a regular cleaning versus doing a deep cleaning or a special cleaning or an expensive cleaning is what the patients here. You can't have a cleaning right now. You've got an active infection. You need therapy to take care of the infection. So like that's what it is. And then once we stabilize the infection, then we can get back to doing cleanings, periodontal maintenance. And what we tell the patients is the goal is that you only have to go through this gum disinfection therapy one time. So if we do a really good job at disinfecting the gums, killing all this bacteria, and you are good about coming in now, because you've had this infection before, you are more likely to develop another gum infection in the future. You're kind of predisposed to these conditions. So we do recommend coming every 3 to 4 months for your cleanings instead of. So that's it. The periodontal maintenance is a cleaning essentially, but we're just seeing them more often so that they don't have to go through the disinfection therapy again. So like that's kind of how we separate the terminology. And I do think it's helpful. Obviously, you have patients that ask, like, what is that? Is that like a deep cleaning, blah, blah. And so we tell them, like, hey, yeah, we don't really use the terminology deep cleaning because it's really not a cleaning.
It's not a cleaning at all.
Cleaning is essentially just removing debris from the teeth. Gum disinfection therapy is eradicating bacteria from below your gum. So it really is a separate process. It's more involved. There's numbing involved. We want to make you comfortable, all that stuff. So like that's kind of step one. Now, my team knows, we're really big on whole body health, oral systemic connection. They know to, kind of explain the risks associated with periodontal disease, gum infections, and dangerous systemic chronic conditions like heart attack, stroke, diabetes, Alzheimer's. And so, we do our best to educate, to create value for the treatment, to create urgency for the treatment so that things don't progress, bacteria don't get in their bloodstream, things like that. But at the end of the day, you still have those patients who say, I understand all this, but I was only coming in for that $98 special. I don't have the money to do this right now, or it's not a priority for me. Whatever they're saying, you know, I'm here. I drove here. I took off work. Can we just do the cleaning that comes with the $98 special? So I have realized that quite often when we do get an upset patient, a bad review, whatever it is often due to this very situation. And so after discussions with my leadership team and my fractional HO, chief hygiene officer, I came to the decision, and we've been doing this for probably at least the last 6 months or so, but I came to the decision that as a one-time courtesy for patients that need periodontal treatment but have no insurance and they're here for the $98 special, we will do a basic superficial debridement. So, essentially the same thing you sometimes do before an SRP anyways, because there's just so much super gingival calculus in the teeth or whatever it is, and maybe gum tissues inflamed, and we want to get better diagnostics. So we'll do that debridement as part of the $98 special. The patient does have to sign a perio refusal form, essentially stating that they understand that they have an active gum infection. They understand the risks of not treating it. They understand that the debridement provided today will not treat their condition, all that stuff. We also have them sign a treatment. We have our separate treatment refusal form. So there's basically two different refusal forms that they're signing if they're doing it. And then my team is told to take that opportunity to continue to educate the patients and provide a great experience. Do a great, quick, superficial debridement of the teeth. Nothing should be subgingival. It should not take longer than a healthy mouth prophy. Remind the patients, as you get to the end of the appointment, like, hey, the teeth above the surface are clean, but just keep in mind the bacteria that are causing this infection, they're anaerobic. They thrive in areas without oxygen. So they're actually in those pockets below the surface on the teeth. We're not able to take care of that without doing that gum disinfection therapy. So please consider it. We'll follow up with you later. Please reach out if you have any other questions. And the other thing I forgot to mention before we even get to this point, if they don't have insurance, we'll typically offer a cash discount, which again, if they do have insurance, are getting the insurance discount fee anyways. But if they don't have insurance, we'll typically offer a cash discount, and we'll offer up to 30% off their SRP treatment because it is something we really believe in. So, we're like, hey, you don't even have to sign up for a membership. We don't have to be running some kind of like special or anything like that. Just any given day, somebody comes in without insurance, they need SRP. It's a struggle for them. We will offer them that 30% discount. And we'll remind them of that again at the end. Hey, you did your initial exam today. We did that, basic debridement. Still want you to think about, returning for the periodontal treatment, the gum disinfection therapy. The offer's still on the table. We're still willing to honor that discounted cash price for you. Even if you can't do it, this month and it's next month or 2 months from now, at some point in time, we want to get to it. And ideally sooner than later, because the longer that infection is active, the more destruction it can do to the bone around the teeth. You can have bone loss, teeth can get loose. And again, that bacteria can get into your bloodstream and circulate through your body. And that same bacteria can cause some dangerous things to happen. So, we are really concerned about your whole body health. We did what you were able to do today. But so again, if how I explain this to my team is because, I did get some pushback from some of our hygienists. And the crazy thing is I'm usually the one who's saying, hey guys, we're missing periodiagnosis. We need to do better at catching it. So I am all about making sure we are properly diagnosing and getting treatment acceptance for periodontal disease. However, let's look at these two scenarios. Let's say we don't have this policy and it's black or white. You have perio disease, you need SRP treatment. I don't care what you say. Your options are either to pay this money and do this treatment or leave without getting any type of cleaning done. What's going to happen? First of all, the patient's going to be upset, and understandably so. And again, they took off work, they came in, all this stuff. They saw an advertisement for $98 special. They're mad that you're telling them that they don't qualify for this. So they're upset. Are they going to come back to your office? Chances are probably not. So they're going to leave without getting any cleaning done. Where are they going to go? They're probably going to go try to find another dentist who will just do a bloody prophy for them. And there are plenty of those dentists out there. So they'll probably find someone else who's going to do it, and they'll get that basically debridement done that we were going to do here or that we could have done there. And then they're going to disappear if they don't have insurance, probably for a few more years. And that perio disease is going to get worse and worse and worse. By the time they finally come in, now they've got 60% bone loss and they need full mouth reconstruction, implants, whatever. So, and on top of that, are they going to refer you any friends and family? No, there's no way. Are they going to write a good review for your practice? Absolutely not. Are they going to write a bad review? It's very possible. So again, a good portion of our bad reviews come from this exact same situation. So that is us not doing it. Best case scenario is you convince them to move forward with the SRP. But again, if they're not going to, this is the road that you're going down. Now, let's say we do it the other way. Let's say we do first try to encourage them to move forward. We offer them a discount on their treatment. we educate them, we create value, we create urgency for treatment. And let's say they're still like, yeah, I can't do this. I was expecting $98. So that's all I can do. So now let's say that we decide, okay, as this one-time courtesy, again, if they come back for another hygiene visit, their only option is SRP. And we remind them of that. But one-time courtesy, we're going to do this for you. It's not a substitute for the periodontal treatment. It's not going to cure the infection. The infection's still there. It will continue to spread until you get definitive treatment done. But we understand where you're coming from. We understand that you were only expecting $98 today. So we're going to honor that for you. We do that. Patient leaves. Are they going to come back? Maybe not. Maybe they don't want to get an SRP done. But if you provide a great experience, now it's in the back of their head. Now we can send them that treatment follow-up letter and reach back out to them, see how they're doing. That's they very well may return. Or even if they don't come back for their SRP, they may say, hey, this was a great dentist and they really took the time to explain things to me. They have a broken tooth, toothache, whatever it is. They may come back for other treatment with you. So much more likely the patient comes back and gives you another opportunity to potentially get the SRP done. Are they going to refer friends and family? It's very possible. Again, if you provide a great cleaning experience and they feel like they were well cared for and they were heard, and you were able to work with them, very possible they'll refer friends and family. Are they going to write you a good review? It's very possible. They might not. They may still be a little bit frustrated that they had to kind of go through that song and dance, but are they going to write you a bad review? Very unlikely. So, on one side, we don't offer this we're unwilling to compromise with our patients. Now, I already hear the argument coming from some docs, standard of care, that's not standard of care perio. I get it. I do. We are not providing periodontal treatment. We are not providing definitive treatment. But again, this is all being explained to the patient. They're signing waivers that they understand the risks. They're signing waivers. We are not doing bloody prophies or gross debridements in place of. Now, again, there's offices that's all they do. There's offices that don't do perio. And I'm not saying that that's right, but I'm saying that's not how we run things. We really prioritize periodontal treatment in our office. But in these unique situations, we are providing not a substitute service. We're providing an extra service. We're providing, again, the debridement that you sometimes do before the SRP anyways. We're providing that as part of the special that they came in for. And the patient is leaving with a full understanding that they still have an active gum infection and that it's not going to get better until they do their definitive treatment and that there's associated risks with it. Is that patient worse off than if they left the office and didn't get any type of cleaning done? I don't think so. Is that patient worse off than if they left our office and found a dentist that would do bloody prophies and now they're going back to that dentist, every so often and getting this bloody prophy done and now they're never, ever, ever going to get the SRP done? I don't think so. So anyways, that's my soapbox. I understand, the counter arguments to it, but I believe the way that we've structured this system, the way that we do it, the fact that it's a one-time courtesy for these new patients. And then, we're not going to keep bringing them back and doing these debridements when they need SRP. I think we really have found a good middle ground compromise for those patients that just aren't ready to move forward with their periodontal treatment.
You ever find actually, I know this happens. There's a whole treatment plan and they only present the periodontal disease and the attitude is, or the perio maintenance. And the attitude is, well, if they don't want to do that, we can't do anything else. And they only present just that. And they say something like, hey, we have to do this before we can do anything else. They focus on it so much where I think they should present the whole treatment plan and say the start of it is, your maintenance, or the start of it is your gum therapy. And then by doing that, we're going to create a better experience for all these other things that are really important to you. So to make sure you have the best experience, we're going to start right here. But this is your whole treatment plan. These 2 implants, this crown, these few fillings, and it's all going to start with this. And I find a lot of docs present only that. And their idea is, well, if they're not going to say to that, yes to that, how can they afford anything else? Well, you're presenting it the wrong way.
Well, so here's what I'll tell you about that. There are certain treatments that absolutely, I believe, perio treatment needs to be done before. If you are doing a cosmetic veneer case and the patient has active perio disease and bleeding gums, I think it is not a good decision to do that treatment before they get the gums healthy. So there are absolutely those situations where I feel like perio needs to be taken care of first. However, I don't think that's true for all cases. we're talking caries control. Now, it's funny. A lot of times, it's like patient either has a bunch of cavities or perio, and I don't know why it's not always like that, but that often happens. But let's say it's a patient with perio and a bunch of cavities. Are we hurting anything by doing the caries control before the perio? I don't think so. So, I mean, we're preventing these cavities from getting bigger. We're preventing them from, needing root canals on these teeth. So, let's say the patient's let's say it's that same situation, and the patient's like, I'm not ready to do this, gum disinfection therapy, you call it, but I do want to take care of the cavities, and I'd love to do some type of cleaning. Okay, great. So we'll do that $98 debridement. We'll have them sign the perio waiver. We'll give them a great cleaning experience. We'll explain to them why they need to come back and do their, definitive periodontal treatment. We'll provide a great experience for the fillings. Make sure they're comfortable, they're happy with the results, all that stuff. Now, at this point in time, we've seen them for multiple visits, provided multiple treatments, provided a great experience. I think we've maybe built some trust with that patient, show them that we're flexible. I think there's a much greater chance at that point that they'll finally come around and do their SRP. Again, if you take the opposite approach and you're like, nope, my standard of care is perio gets dealt with first. So we can't do those fillings before you do your perio treatment, and we can't do any type of cleaning before, blah, blah, blah. Again, patient's mad, they leave, maybe leave you a bad review. Maybe they find another dentist who's going to do things the way that they want it. Or maybe it's been a long time since they've been the dentist and they worked up a lot of courage just to come in and see you that day. And maybe they don't go back to their dentist for 10 years. And all of a sudden, these cavities that could have been fixed with fillings, maybe crowns, all of a sudden they've got bombed out teeth that need extractions and implants, or, at the very least, root canals and crowns. That perio disease has gotten worse. So, all of a sudden, this patient that you could have at least started on their journey to health. Now, again, maybe they don't want to do everything exactly the way that you feel like it should be done. If we were doing things in an ideal chronological order, okay. But like, can't we at least start them on that journey? I mean, I think, again, guys, I'm not telling you to do dental treatment that is ethically wrong. I'm not telling you to do treatment that's not needed. I'm not telling you to do a big cosmetic case on a patient that has 80% bone loss. Like, I'm not telling you to do any of those things, but I'm saying, can't we have a little bit of flexibility and work with patients a little bit so that way we can listen to them, hear what's most important to them, and start with some of those services when it makes sense. So that way we can build trust and eventually, hopefully, help that patient complete all of their dental journey. I mean, to me, that makes a lot of sense. So,
We have to wrap this up, guys. This is something where, like, I hear about this every day, the barrier of perio maintenance. And, like, I hear docs say, like, all these patients that are coming in all need perio maintenance and they're not candidates for all the treatment they need. They are candidates. You have to do the perio maintenance first and stop talking about it as a cleaning and start talking about it as treatment and put it in the treatment. They are candidates. This is the first thing they have to do. And if they need perio maintenance, what I'm going to predict is they're your highest value production patients because their mouth is full of work, right?
potentially, like I said, it doesn't, man, I can't tell you how many patients I've seen that have perio disease and have no other cavities or work done. So it really can be a like, hey, teeth are fine, but the gum and tissue's not. So it's definitely pot, but it's not always that way. So um guys, I hope this was a helpful episode. Again, like basically the big picture idea, if we kind of zoom out a little bit and we kind of get off the perio train, the big picture idea is find a way to work with your patients again in a way that makes sense. I'm not telling you to go to extremes and do treatment you're not comfortable with, but like we got to work on not being so rigid. I think in dental school we were taught you got to do things A, then B, then C, then D, then E, then F. And I don't think that that's always the case. And I think when we are super rigid and we're unwilling to bend or be flexible with patients, when we're unwilling to listen to what's important to patients and prioritize a treatment that's important to them, um, I think it makes it you're making it much tougher on yourself to close treatment, and you're creating a barrier for your patients to get treatment. So just think about that. I'm not saying that, everyone's doing that, but I'm saying, do a little self-analysis and think about if maybe you're a little too rigid sometimes with your patients. Now, I will say, guys, there is my caveat to this is if I feel a certain treatment is needed, I won't back down if a patient requests otherwise. So, like for example, if I know a tooth needs a crown, 100%. This is not a gray territory. This tooth needs a crown. A big filling is not gonna be a good long-term solution. It's gonna break. In those situations, I'm not going to let the treatment or let the patient choose their treatment when I know that that treatment's setting them up for failure. So that to me, that is a different scenario, than working with patients on timing or starting the journey with something and finishing with something else, that type of a thing, so.
Well, guys, we have to wrap this up. Thank you for joining us. Me and Andrew don't have sponsors come on. No one can pay to come on. We do this for the betterment of the community. Please hit like, subscribe, and share. Thank you guys, and have a great day.